My name's Craig James Szmigiel, and this is my story. It all starts 2 years ago when I just turned 24 years old. It was the summer of 2013. Life was great. No worries, no stress. I take my daughter Anya on her first trip to the Detroit Zoo. We made it a family day. That night, my girlfriend at the time claims I woke up in the middle of the night yelling in agony from excruciating back pain. I stumbled down the hallway trying to reach the bathroom, but I can barely walk as I'm holding myself up against the hallway walls. She calls for help and I'm taken to Beaumont Hospital. A neurologist comes into the ER and asks me, how many fingers am I holding up? I can't see anything, I told him. I had completely lost my vision. I was blind. Several lesions had already developed on my brain and spine, and I was paralyzed from the neck down within a matter of a couple hours. They began infusing me with steroids. By the second day, I wasn't able to breathe on my own. They had to force a breathing tube down my throat and put me on life support. The doctors decided to heavily sedate me and place me in a medically induced coma because my body was on overload. My lungs had developed double pneumonia, and the left one collapsed and a chest tube had to be inserted through the skin. It didn't take long before the right lung collapsed as well. Another chest tube had to be inserted. My body began to quickly fill up with air as a result. I spiked 104.6 fever and had to be covered in ice packs and cooling blankets. The survival flight helicopter from the University of Michigan Hospital picked me up and took me back to Ann Arbor. A couple days later, I heard the most terrifying thing one could ever hear about themselves. The doctor turns to my brother and my mother and says, "We're giving him a 20% chance of survival. If he does survive, he will never walk again. I'm sorry." It was pandemonium inside my head. I'm not exactly sure where my conscience went, but I was no longer in the hospital. Physically, yes, but not mentally. My brother says that once I heard that news, my breathing slowly began to improve, but my lungs were still very damaged and infected. They gave me heavy doses of strong antibiotics and another 5-day course of steroids. I'm not sure if it was someone in my hospital room at the time or what, but I heard someone or something say, "He's a warrior," and that encouraged me to fight. They began to wean me off sedation, and I would slowly come back into consciousness. I began to get uncomfortable with the tubes in my mouth, so they performed a tracheotomy, which made my breathing a little easier for me. The doctors concluded that the infection came from an antibody that I have in my blood. Something unknown causes the infection to trigger an attack. They called it NMO, neuromyelitis optica. They say it's going to be a lifelong battle. My vision is coming back, but still very blurry. I look at the whiteboard in front of me and I see today's date is 8/31/13, the last day of August. I call out to my brother even though I can't talk since there's a tube sticking out of my neck. I can hardly recognize him with the blurred vision. "What's up?" he asked. I mouthed the words, "When's the last time I saw Anya?" "About 4 weeks ago," he said. That's when it hit me. I can't recall the last month of my life. I haven't seen my baby girl in a month. Instant tears flowed on my face. I needed to see her as soon as possible. My brother has this picture right next to the hospital bed. I now recall hearing voice recordings of my daughter saying, "I love you, Daddy," that my girlfriend and my family were playing for me while I was in the coma. The next day I got to see my princess. She was shy at first because I did not look the same, but she knew exactly who I was. I got a long overdue kiss and she held my hand. I got visits from my very supportive girlfriend as well as my boys who have been lifelong friends of mine. High fives and hugs were difficult because only my left arm had some mobility and both shoulders had unbearable pain. Therapists explained to me that when the muscles and tendons become so weak from laying in bed for so long that the joints fall out of socket, I basically had 2 dislocated shoulders. I had to begin some acute therapy to get some muscle strength back as well as attempt to wean off the ventilator, or life support as they called it. I was able to be in somewhat of a standing position for the first time in a month and a half. I was strapped to a tilt table that would slowly stand me up from a lay-down position. After laying down for so long, I got dizzy real fast. Due to the infection in my lungs, I was always trying to cough up phlegm. They constantly had to suction the secretions out of me. I would wake up in the middle of the night choking on my own mucus and would have to wait for someone to help me clear my airways so I could breathe again. Sometimes it would take a couple dozen attempts before I could breathe. My neurology team wasn't as optimistic about my progress as much as the rest of my medical team was. So I was infused with more steroids, a blood product called IVIG, and a chemo treatment called Rituxan. I was transferred to Select Specialty Hospital in Mount Clemens to get weaned off the ventilator. It was closer to home, so I was able to see my daughter and my girlfriend more, which put me in a much better mood. My legs locked up and became very spastic. It took at least 2 people to separate them in order for the nurse to insert a catheter to relieve my bladder. I would eventually end up getting a drug infusion pump installed on the left side of my stomach that would deliver medicine to my spine to help control the tone and spasticity. It took me a month to ultimately get off life support, and I was able to finally have my first sip of a drink and bite of real food in 3 long months. It was also the first time I was able to be outside in 3 months as well. I was able to briefly enjoy the fall weather after watching the Lions game. I was then transferred back to U of M Hospital to begin inpatient therapy. I attended intense physical therapy and was determined to get my body back as strong as possible. Occupational therapy helped me regain motor skills and taught me how to live daily life with a disability. I became close friends with doctors, nurses, therapists, and other patients. After all, I spent 5 consecutive months in these hospitals. Thanksgiving, I was able to go home for the day and test out what living at home with a disability would be like. A couple weeks later, I was home. And this time, I was home for good. For the last 2 years, I've been trying to rebuild my life. One thing I've learned is to humble yourself, because you could always end up right back where you started. Back at square one again. I need to learn how to walk again and keep my balance. Learn how to go to the bathroom on my own again and build my body back up to how it used to be so I can take care of my daughter. After all, she is the main reason why I'm working so hard. I believe, and I know, in my heart, that this disease will never get the best of me.